Where We Live from Connecticut Public Radio. I'm Sujata Srinivasan, filling in for Catherine Shen. This weekend, former President Donald Trump was injured in an assassination attempt at a campaign rally. One person was killed and another 2 people were critically injured in the attack. After high-profile shootings, there's often debate over the politics of guns. But U.S. Surgeon General Vivek Murthy wants us to think about guns through a different lens: public health. In June, he declared gun violence a public health crisis in the U.S. Across the country, more than 200 people visit the ER for non-fatal gun injuries each day. That's according to the Johns Hopkins Center for Gun Violence Solutions. Today, we are looking at the public health approach to gun violence prevention. Later this hour, we'll hear from parents of gun violence victims. But first, we'll hear from an ER doctor about what he's seeing in Connecticut and possible ways forward. Joining us now via Zoom is Dr. James Dodington, he goes by Jim, Medical Director at the Center for Injury and Violence Prevention at Yale New Haven Health. Dr. Dodington, welcome to Where We Live.
Thank you much, Sujata.
I can call you Jim, may I?
Please.
The attempt on former President Donald Trump's life has once again elevated gun violence in public consciousness. But people living and working in urban neighborhoods across America, like yourself in New Haven, witness gun injuries every single day. Would you describe, please, paint a word picture, if you may, what you and your colleagues are seeing?
Yes, by all means. So I think this weekend was really indicative of the crisis of gun violence in the United States. We saw, of course, the very high-profile incident with the attempt on former President Trump's life and the injuries and death there. And then locally, to my work in New Haven, we had a very significant weekend in terms of events of community violence. And I think as I process going into this week, I realized that is the picture of gun violence in the United States. We are seeing such high levels of consistent both community violence and then self-injury. We know suicide numbers are very high. And Dr. Murthy's public health statement, I think, is probably the most important piece, which is we need to frame this epidemic as a public health problem.
And let's take a listen to what the Surgeon General said in June.
As a doctor, I've seen the consequences of firearm violence up close in the lives of the patients I've cared for over the years. These are moms and dads, sons and daughters, all of whom were robbed of their physical and mental health by senseless acts of violence.
And he talks about gun violence being a lot, it's always more than statistic. These are daughters and sons and moms and dads and brothers and sisters. So in basic terms, approaching gun violence through this lens, how does a public health approach change the narrative? I mean, what does it even mean in basic terms?
Right. So I think the most important piece we want to think about in taking a public health approach to firearm injury is to have a full vision of the epidemiology. So one of the most important pieces, and Dr. Murthy brought this forward, another mentor of mine, Dr. Lois Lee, put this forward in the New England Journal of Medicine recently, that there has been a crossing of lines. There are more children ages 1 to 19 killed by firearms than there are through motor vehicle crashes. And that's a really staggering statistic for our United States. So first and foremost, we need to understand the problem, the epidemiology. We have large numbers of folks that are injured and then, of course, sadly die by firearm injuries. And then we need to make, with that information, approaches to firearm injury that are evidence-based and evidence-informed. So I just want to take a moment to say that here in Connecticut, we have been incredibly fortunate to have a Department of Public Health that is very on board with this approach to firearm injury. And there is a DPH commission upon which I sit that is really looking at these mechanisms of injury, both suicide prevention as well as community violence intervention and prevention, trying to attack this problem from a public health perspective.
But in the first place, how did gun violence become so common in the U.S. today? The Centers for Disease Control and Prevention categorizes the 15 to 24 age group as having among the highest burdens of firearm injury. This show's senior producer, my wonderful, lovely, brilliant colleague, Tess Cheruble's brother, died by suicide with a gun at the age of 15. So what's it about this age group that puts them at a high risk to themselves and to others?
Yes, so first and foremost, we know that that young adult age group, that kind of late teen and young adult age group, is a very high risk time. There are many firearms across the United States. Some folks put that figure in the 400 million range. And so I think as a public health professional and as a physician who's been at the bedside, sadly, of families who have suffered these losses, I think it's most important that we think about ways to improve the situation that really are in the public health lens. We often talk about harm reduction and we talk about means mattering, meaning that firearm safety and making sure that firearms are safely secured
Like
is a
Ethan's
critical
Law.
step.
Sorry, like
Yeah.
Ethan's Law, for instance. Yep.
Indeed. So I've had the incredible, fortunate chance to work with Miss Kristen Song, who helped, of course, establish Ethan's Law, and just incredibly tragic how she came to this work. But she has been an incredible advocate alongside Paul Murray and others in that space. So again, that critical area of the young folks that are impacted by gun violence. The Surgeon General is very careful to really highlight that as a place where we need to make intervention, both in community violence and in more urban areas and in, of course, protecting and securing weapons properly.
When you look at gun violence through public health perspective, how does legislation work? What does it mean for policies taken at the local and federal level? I mean, would it look similar to what we've done in the past with tobacco, motor vehicle crashes? I mean, what do you see? How do you see this playing out?
I think it's very important, and the Surgeon General does a good job in his report as well, stating that there is not just one mechanism to impact firearm injury and gun violence in the United States. You have to attack all of these different mechanisms. So the self-injury, community violence, I would highlight that one of the most important things here in our state of Connecticut is that the highest rates of injury by firearm are young Black males, and then also there are high levels of suicide injuries in older adults. This was recently highlighted in our DPH commission. So we need different mechanisms to attack those problems. And there are legislative angles to both reinforce firearm safety, so secure storage, like Ethan's Law, like you mentioned, and then legislation that allows for investment in community-based interventions for community violence. I think those are two really important pieces that we know can have an impact and need to be emphasized.
I think those of us who work in public health or cover public health have long known that health is a lot more than prescribing medication and a patient taking it, right? I mean, health is at the intersection of housing, intersection of education, intersection of food security, nutrition. And you have one possible solution underway, and the pilot results, I understand, are just out. It's exciting. Last year, I interviewed you and Sarah Blanton, CEO of a Connecticut nonprofit called 4CT, and I did a story about 4CT's cash assistance pilot program that was launched at your hospital, Yale New Haven Hospital, where 4CT offered financial grants to victims of gun violence treated at the hospital. But before we get into the preliminary findings that are just out, tell me about the program itself.
Thank you so much for highlighting this. So this is part of our hospital-based violence intervention program. This is a national movement in which healthcare professionals really engage in the space of treating victims of violence and really attending to their what we call social determinants of health. So as you mentioned, Sujata, the pieces around housing, around income stability, and being able to stabilize folks after injury. We realized very early on that in our program, one of the most critical elements of treating a victim of violence is helping them get back on their feet. And a big piece of that is having some degree of financial stability as they're trying to leave the hospital and go back to their lives. This led to a wonderful partnership with 4CT and the project that we endeavored over the last year or so. We are part of a national movement. What our largest kind of organizing body is called the Health Alliance for Violence Intervention. And that group is deeply involved in this work.
So tell me, what are your preliminary findings?
Yeah, so the findings, as we are just beginning to understand the perspectives of the folks that took part in our program, We did a qualitative analysis, so interviewing folks who had received the cash assistance as part of our program, and we found three primary themes. One was that meeting basic needs is the most pressing concern following injury. So we need to be able to provide folks with some of those key basic needs. Things like paying for medical care, lost income, being out of work, relocation is a big issue for victims of violence. Secondarily, emergency cash aid empowers participants with discretionary funding that can promote their personal agency. They're more likely to engage in those key activities that we want them to be able to experience mental health recovery if they have that assistance. And finally, that the cash aid may reduce the actual injury recidivism, meaning return to care for injury. And that's their perspective, that this may help you change your trajectory. And that's what we want to do. We often hear about breaking the cycle of community violence, and we need an all kind of encompassing approach to assist folks in these social determinants in doing that.
So the cash assistance, and I understand it's around $500?
Indeed, there are oftentimes two potentials. There's $500 and then $1,000 for the next of kin of victims of homicide.
And injury recidivism, I mean, if that is the ultimate goal, I suppose, is that the goal of offering financial grants and trauma healing as well?
It is. And I'm proud to say that as part of our national movement, we work closely with other hospitals and health systems that do this work. I was just on a meeting with a colleague in St. Louis in the last day. They've shown that by providing these kinds of intensive case management services for victims of violence, they can reduce their re-injury rate by upwards of 60%, which is really an incredible number in the scheme of community violence, where we have seen very little kind of scientific publication around doing this work and providing these comprehensive services. So we're very excited to see that, and we hope that there'll be further investment and legislation in this area.
Right, and from what from Sarah's initial plan for this program, the pilot, the grants were, private. I mean, they were funded privately, by individuals, by high net worth donors that believed in this strategy.
Indeed. And we hope that there is further public investment as we see the outcomes improve in this area. We also serve, importantly, victims of domestic violence and interpersonal violence, of course, many of whom can be injured through firearm injury as well. And that is a very important point, that stabilizing families and those that are injured by these multiple mechanisms is incredibly important. And financial stability is such a key piece of that.
I find it important to note that the cash gifted to patients was not spent towards what some people might expect. Our producer, Tess Terrible, interviewed 4CT CEO Sarah Blanton.
We see, because of the way that we have designed the distribution of money with our card partners, we can see all transactions. People are spending money on rent. They can withdraw cash. They spend money on rent. They spend money on utilities, phone bills, food. It's groceries, it's transportation, it's clothing for kids. It's all the basic stuff. We have no restrictions on these cards. And so people can spend the money on anything they want. And we're not finding that they spend it on the things that I think many people worry about. They're not spending it on alcohol. They are truly spending it on helping themselves recover. It is not so much money. It's not going to keep you afloat forever.
This is where we live. Stay with us. This is Where We Live from Connecticut Public Radio. I'm Sujata Srinivasan, filling in for Catherine Shen. The debate over guns is more heated than ever, but viewing gun violence through a public health lens perspective could change the conversation. Still with us is Dr. Jim Dodington, pediatrician and medical director at the Center for Injury and Violence Prevention at Yale New Haven Health. He's on Zoom. Joining us now in the studio is Mark Barden, co-founder of Sandy Hook Promise. Mark lost his son Daniel in the mass shooting at Sandy Hook Elementary School in 2012. Thank you, Mark, for being with us here today.
Thank you for having me.
It's been more than 10 years since the Sandy Hook shooting. How are you doing today?
We take it day by day. we constantly think about our little Daniel and what he'd be doing now, what he would look like now. He should be 18. He should have just graduated high school. Some major milestones, and we just continue to honor him the best we can and to provide as much love and support as we can for our surviving children, James and Natalie.
And you are extending that love and that support to children beyond your family. You now have Sandy Hook Promise started after Daniel was killed. He was just 7. What kind of work does Sandy Hook Promise do? What's the vision?
We started Sandy Hook Promise shortly after the tragedy that took our little Daniel from us, with really the simple plan to prevent other families from having to live and endure this lifetime of pain caused by preventable gun violence. So we did a lot of research to try to identify what hasn't been worked on, what great organizations were already doing some work in this space, what hadn't been truly addressed. And we found that the true essence of prevention, excuse me, by learning that there are just about always warning signs before someone hurts themselves or others. For example, we know that 4 out of 5 school shooters talk about their plans to someone else, usually more than one person. Oftentimes in a public forum like a social media platform. So we've learned that if we can empower and train and educate students and adults with the knowledge of how to look for these warning signs, how to know the signs, and then give them the tools to take the next step to get somebody the help that they need before it becomes a tragedy, we can prevent a lot of these horrific tragedies from happening. And to date, students trained in our programs have now prevented at least 16 school shootings from happening, along with over 700 suicides. So we really set out to honor our little Daniel, who we acknowledged as the caretaker of all living things, because he would take care of insects as well as his family and his peers around him. He was incredibly compassionate and aware of others. And so I do this work to try to bring his legacy, to keep that going, because it was taken away from him. So we take this work very seriously.
And Know the Signs, the program that you developed and gave to schools across Connecticut, I understand it's expanding. We met, and I had the honor and the pleasure of interviewing you for a news feature story. And a pilot is underway nationally, with starting with Atlanta and in the Bronx. So how does this program fit into conversation about gun violence as a public health issue?
We recognize that gun violence affects all of us. It has nothing to do with your political stripe or any other ideology. And the initiatives that you mentioned, Atlanta and the Bronx, are just 2 pilots that we are currently working on. So we are learning how to understand and identify the unique challenges that different communities face, and how to respond to those challenges in a more meaningful way, and to achieve better outcomes. So District 9 in the Bronx, for example, we are hiring staff from the district who understand the needs and the cultural and other challenges that the students there and the families there are facing, and how that we can tailor our Know the Signs programs in a way that meets their needs more specifically, and then we can take those learnings and apply them to other communities across the country. But in the over 10 years since this organization has been in existence, we have reached students and adults in all 50 states with our programs, and building that to scale. We can see that through our Know the Signs program, like Say Something with the Anonymous Reporting System, and our Start with Hello program, we can also have a positive influence on the culture. As well as stopping the bad things, we're also fostering a culture of students and families and communities that are more connected, more observant of one another, more likely to be upstanders for each other.
Mark, once a student reports on something that they find to be not consistent with the flow of things, a social media post or a comment made on a school bus, after the reporting, does the program also have pathways to medical intervention, psychiatric intervention, counselors for these students?
Yes, when Sandy Hook Promise trains a school district on our Know the Signs programs, before our anonymous reporting system goes live, we've already connected with all the support services in that district, so that when a tip comes to our crisis center, let's say a student is feeling concerned for themselves or for somebody else, they can send a tip into our crisis center, who already knows who all the support systems in that community are. So based on the nature of that tip, they can get help to where it's needed at the appropriate time and place.
I spoke with Monica Brady, principal of the Bronx School, and she was delighted the pilot is offered at no charge to schools, and also that it's designed in a way that resonates with kids in that particular economic, racial, and urban demographic. Now, how will this type of customization impact outcomes?
So we don't believe in a one-size-fits-all model, because students living in District 9 in the Bronx are facing different challenges than students living in Council Bluffs, Iowa, than students living in South Central Los Angeles, Chicago, rural or urban communities. So we want to understand better the communities that we serve, so that we can then affect better public health outcomes for those communities. And we understand that, we have a lot of learning to do, and we don't assume that we know what these communities are dealing with and what their challenges are and how to effectively respond to them. So we bring in folks from the communities, we learn from them, and the whole process is based on feedback from those communities, from those principals, the school administration, the teachers, the parents, the students themselves. All help inform us as to what their needs are, so that we can customize our programs in a way that meets those needs better.
So you are imparting knowledge, but you're also learning and growing, and it's a constant, it's a symbiotic back and forth.
Oh, always learning and growing. We never assume that we know enough. We always want to know more.
Now, what is disturbingly, seemingly becoming normalized. About 1 in 4 U.S. teachers say their school went into a gun-related lockdown in the last school year. That's according to the Pew Research Center. You're pushing for more legislation to help make schools safer. The Plan for School Safety Act has bipartisan support, and you have a track record, a history of pushing legislation under Republican and Democratic administrations. And Republican Congressman John Rutherford of Florida is the bill's co-sponsor, this one, the Plan for School Safety Act. And I understand Sandy Hook Promise will help create school safety centers as part of this act. Tell me more.
So we've long said that gun violence doesn't care about your partisan affiliation. And we are truly nonpartisan. I like to say we start the conversation with, we all want to protect our children. And that's a fundamental core value and human need. And we start from there. Again, it doesn't have any political affiliation, partisan affiliation whatsoever. And so we are proud to have worked with all of the presidential administrations that have been in existence since Sandy Hook Promise started, and we've been able to support and write legislation and pass it with bipartisan support under all of those administrations. And this current piece of legislation that we are working on, like all of the others, enjoys bipartisan support. And yes, it establishes a centralized school safety center in each state. Some states already have them. We can bolster them and help them be better. Some states don't have them at all. We would like to establish them under this legislation. We've identified, hopefully, a robust and growing funding stream to help develop this. Right now, it's in its pilot stage. It would be in its pilot stage once we get this legislation passed. But it would help inform school districts on what are vetted, research-based, research-informed programs that can help them and create a safer environment for their students and their communities, with wraparound holistic help for those students, where they can be they can be safe in school and on their way to and from school and in their communities and as well at home. So we feel these school safety centers would do a whole lot of good. They'd be staffed with trained professionals across a few disciplines, including mental health professionals and support.
Dr. Dodington, Jim, who's with us here on Zoom, you graduated medical school 2 years prior to Sandy Hook. How have you seen things change and evolve since then?
Yes, and just first and foremost, I'm honored to be here with your guest today. I think we, as particularly pediatric emergency medicine physician docs, it's just really been the last 10 years have been thinking about and worrying about the possibility of violence within our schools, and particularly for younger folks. So I think one of the most important things that we do in our training is constantly thinking about ways that we can respond to crises and disasters. But we know for a fact that the work that Mr. Barden and and his group are doing in terms of prevention is the most important thing. Our trauma surgeons, the folks that respond to these events most acutely, always point out that even the best doctors, when it comes to firearm injuries like this, can do very little. So it's the preventative work that we must emphasize.
Right. And what do we know about how gun violence impacts patients and their families long term? I mean, Mark here is living it. But among the pediatric population, especially, Jim, what do you see?
Yeah, so just very briefly, and this was highlighted in the Surgeon General's statement, that the gun violence impacts are across the ecosystem, across all family members that are exposed, communities that witness both directly and then, of course, through media and other means. We know from a scientific perspective very little, much less than we would want to know about the downstream impacts, particularly for survivors and their direct family members. And we would hope that in the coming years, through collaborations with survivors, that we will begin to learn more. And some of the incredible advocates that have come out of tragic events like Sandy Hook have been real leaders in that space, and we hope to see more support.
Thank you. Mark, despite the ample health data we have on gun violence and how much it's impacting pediatric and young adult population, is this framing going to change things in terms of, perhaps more research funding dollars, perhaps more collaborations, more elevated conversations in the public space? What do you expect going forward?
Well, first of all, I want to say thank you to Dr. Dodington. It's an honor for me as well to be partner with you in this work. Thank you for your good work. And to your point about the Surgeon General's advisory, yes, it's a critical step. It's very important that Dr. Murthy has acknowledged this as the public health crisis that it is. And yes, to your question, we would absolutely expect to see a raise in consciousness from the public health, from the public community, from the community in this narrative that this is a public health crisis, and hopefully that avails more funding for research, that increases public awareness, and therefore more activism, more engagement. There's lots of things that folks can do. They can help these organizations doing this work in this space. They can donate their time, their dollars, their resources, their connections. It needs to be, we just heard that it's the number one killer of young people under 19. It should be somewhere around everyone's top issues to engage with and to see how they can be helpful. And I think if we can foster that public engagement enough, I think we can certainly see a whole lot more progress made in this epidemic.
You're listening to Mark Barden, co-founder of Sandy Hook Promise. Thank you, Mark, for being here with us today. And Mark, please take care of yourself.
Thank you.
Your wife, Jackie, your two beautiful children. You're not alone. You have an outpouring of love and support.
Thank you so much.
This is Where We Live from Connecticut Public Radio. I'm Sujata Srinivasan, filling in for Catherine Shen. Today, we are talking about gun violence as a public health crisis. The U.S. averages one mass shooting every day, but mass shootings account for a fraction of gun-related homicides. Reverend Sam Saylor of Hartford lost his son Shane Oliver to gun violence in October 2012. Shane was just 20 years old. In April last year, Shane's daughter, Reverend Saylor's granddaughter, Secret Pierce, was killed by a drive-by shooting in Hartford. Secret was 12 years old. Joining us in the studio now is Reverend Saylor. And still with us is Dr. Jim Dodington, Yale pediatrician. Thank you for being here.
Thank you for having me.
Reverend, how are you doing today?
I'm doing blessed. I'm safe.
Firearms are the number one cause of death for children and teens in America. That's according to KFF. More than half of the state's gun homicide victims are Black, according to Connecticut Against Gun Violence. Reverend, tell me what you've witnessed over the years and continue to witness in Hartford.
Well, I witnessed the tragedy, the public tragedy, tragedy and destruction of lives. I watched the growing tragedy that seems to be unabetted by any logical leaders in our nation. Be pushed down the road. I see increasing gun violence, increasing gun possession in our communities, use of guns to solve issues and disputes, and crying mothers and crying fathers with broken hearts continue to be a daily parade in our community.
Today we're talking about gun violence as a public health issue. In the long term, on an ongoing basis, how has gun trauma affected your family and your community, both in body and in mind?
Well, I believe that that our gun violence that happened in urban communities around America, in our lives, as personally, is a walking death that we have to live with. We bury our children, we put them away, and we say goodbye to them in their homegoings, and we cry for forgiveness and peace in our lives. But every day we live with the absence of our children and our loved ones, and every day we live with the possibility of another occurrence happening in our lives, that we're not free from this trauma, this parade of pain.
You're living it. And Dr. Jim Dodington, who's still with us, according to your research, survivors of gun violence have a sequence including a re-injury with a firearm and mental health disorders that often go undiagnosed and untreated. And this is according to a paper you co-authored. It's a pilot clinical trial of the screening and tool for awareness and relief of trauma for survivors of gun violence. Could you talk about, briefly explain, why people who survive experience gun violence are so susceptible to re-injury?
Yeah, thank you so much. And first and foremost, just thank you to the Reverend for his incredible voice, advocacy, and his work in this space. We know, particularly in injury with firearms, that there is a very high risk of mental health concerns afterwards, both for a victim, of course, if they survive, but also impacts to communities and families, as the Reverend described, who are living with that trauma and that tragedy. It's important to note here that there has been not nearly enough investment in that side of what we would say the post-event. So the investment in understanding survivor perspectives, the needs for them from a mental health perspective, and that the levels of post-traumatic stress, of course, are incredibly high. We see that particularly in victims of community violence and their next of kin. And that is an area where there really needs to be more focus and investment going forward.
And it's unprecedented. I mean, with the wealth of the United States compared to some, our other countries in size, comparable size and wealth. I mean, no other country is in this position of firearm injuries being among the top causes of injury and the ripping of communities like it is in the United States. Now, I was at a roundtable with Hartford school kids and Senator Chris Murphy many moons ago. And here's what one child said that I have not been able to get out of my mind. I carry it with me, and it's heavy and it's heartbreaking. Let's take a listen.
That was me one day. What if I got shot? What if my parents got shot? What if my friend got shot? What if my cousin got shot? And that's what sometimes makes kids disappointed and upset and mad. And sometimes you could just wish that things were a bit better.
And this is a young child sharing with the senator his fears. He's afraid of being shot. Now, there are parks in Hartford. There are open spaces in Hartford, and it's not just Hartford, it's New Haven. It's all of our urban spaces in Connecticut and across the country. Yes, there are parks. Yes, there are places where children can go to. But where can they go if they're afraid of being shot?
That sentiment of that child is exactly what is the untold story. It is the greatest attended class in school and in community. My next. Am I next? And this seems to be one where, you can't stop it. It doesn't have any safe grounds. There's no hedges to protect our children. So they study in their mind, am I next? They navigate the streets and wonder, can I get home? How do I get home? How do I get to the corner store and back home safely? Because I've watched just the other day someone who I was playing with shot dead on the street. I saw their brain matter on the road. I saw the blood still on stains on the street. I see the yellow tape that they leave behind. And you leave me with no protection. What do I do? What's the answer to it? And no answer comes, no remedy comes. So I have to live with it. I have to deposit inside my soul and try to wait for the best. I pray that God will send me a protection. But he didn't send Johnny a protection. He didn't send Susie one. And tomorrow, who's going to be next? Am I going to be next? I know some of the people who carry guns. I know some of the maladies of my community, but I can't fix them and I can't escape.
Heartbreaking, Reverend. Here I am, a journalist. Here you are, an activist in your community in Hartford, a reverend, and we have a pediatrician from Yale, and we are adults, and this child is asking that question, will I be shot? And, we don't have the answer. We are just devastated.
We owe our children an apology for not being able to take up the storm that is coming in their lives, destroying them and changing the narrative of their youthfulness. We owe them a great apology because we failed to produce a safe America, and that's just unforgivable.
Reverend Saylor, your son Shane was shot dead 2 months before the Sandy Hook tragedy. And I understand you met with President Barden when he was visiting Sandy Hook. How was the outcome of that meeting? What went on?
Well, one of the things that I'm publicly talk about is that I see and perceive that urban gun violence is treated like a footnote, an appendage in this conversation that we still have today, that it's gun violence happening in suburbs, but then also the gun violence in urban America when we've been experiencing this kind of trauma for a long time. Vice President Biden came at the time of Danbury, had a discussion. I was sitting in the audience with a father next to me, to the left of me, crying. I thought he was mocking me because his tears sounded like my tears. And then I realized that he was a father from Newtown, lost a son. And in his mind, I can only imagine, he was imagining the same thing, that I'll do anything to have my son back in my arms, back alive, someone I can look at and see the future and legacy of my life passed on. And we were in the same parade, we're in the same club. I realized that we're together in this fight, that it's not, them or us against each other, and that we have to fight together for trying to find a remedy for this. And I was bonded to Newtown. Before, I thought they were getting all the limelight, they were getting all the attention in urban violence, and my son was being left behind, And I recognized that, what happened to the tragedy of those babies. They were assaulted, not assaulted, just butchered with that assault rifle, and America grew up conscious. And hopefully that conscience continues today to continue to push against gun violence.
And the outcome of that meeting with our president, with President Biden?
Well, he acknowledged that we were a footnote. He said, I was surprised. I said, we are treated like a footnote in urban America. And he said, you are. But before Those 20 little babies in Newtown died. Anybody that tried to bring up gun violence reduction in Washington was treated as a joke. At least those babies got the door open. Help us get the door open wider. And, I didn't know he would ever become president, to hopefully push this agenda forward. And I hope, I don't get into politics, but I hope we continue along that road to push that dream to come true and be a reality in our community.
Regardless of who is in power. And as you say, the common ground here is our humanity.
Yes.
Transcending
Yes.
the color of our skin, transcending religion, transcending politics is love of family. It's love of community. And, that is, if that is not the common ground, then what
is the common ground?
Still with us, Jim Dodington from Yale. I want more, please, about this program, pilot program, that the preliminary findings are just out, where the Connecticut nonprofit Force CT has provided cash assistance to gun violence victims who are treated at your hospital, Yale New Haven Health. And there were very positive outcomes from that pilot, as those results just point out, the results just out. And I understand that this pilot is now expanding, and a collaboration was just formed, expanding out of New Haven to Connecticut Children's Hospital right here in Hartford. So tell me a little bit about this expansion, please.
Yes, thanks so much. And just building on the incredible story that the Reverend told us, we know for a fact that this pilot and this work is really geared towards addressing victims of community violence, those HVIPs, those programs that are based out of hospitals, but of course in deep partnership with community organizations doing this work in Hartford and in New Haven. And we also have partners in Bridgeport, and we're looking to expand from there. Just an important note from our recent CT-DPH data, the rate of homicide for African-American or Black non-Hispanic males in Connecticut is almost 30 times the rate of white non-Hispanic folks. And so we just see this incredible and staggering disparity in Connecticut. And so an important point that we need to state out loud as often as possible in terms of the investment in these programs, the investment in this area. So to build on your question, we're hoping to see more of these cash aid assistance programs. So these will augment the services that are provided to victims of community violence. My colleagues at Connecticut Children's and the incredible community organizations based in Hartford are going to be able to provide some of that cash aid. And then our hope is that as we build further evidence for this work and we're seeing folks join nationally, we will then have really a case for making this more of a federally possibly funded and supported program.
Reverend, what's your take on programs like this? There was a pilot in New Haven Hospital that has some promising preliminary results, cash assistance to victims of gun violence treated at the hospital. So what's going to happen when that program is replicated here in Hartford? I mean, what's your initial impression about it?
Well, it's the impact of the cash. It's not so much the cash, but it's to be able to help maintain the dignity of the grieving. I mean, we've been in homes in Hartford and in urban areas where, your child is dead. People are coming to your house. You can't offer them a cup of water. You can't offer them a cup of coffee. You can't have them donut. I've seen Reverend Brown, who runs Mothers United Against Violence. He would go take his last dollar to buy a dozen donuts to bring to the house. Or the mother said, I need people coming over. I don't have anything to give them. I can't clean my house. I can't go to work. I can't cook. Who can cook when it just came from the coroner's office? I mean, who can think of buying food when they can't get the image of their dead child out of their head? So that cash advance helps to solidify or at least maintain the dignity of the humanity that you talked about earlier, that humanity that we need to save. It helps with that. And I hope that it increases. It's just that little bit of help goes a long way in healing people in the process.
And beyond that, the cash going towards rent assistance or towards, food, towards groceries, towards
sometimes escape
whatever.
out of the environment where your child was dead. Sometimes most likely happen in the domicile where they live at, and they don't have rent money to go somewhere else. They're on a lease and they can't get out, but they have to live in this trauma. And we need that cash to move them to a hotel or move them to a place where the trauma isn't revisited night after night of the incident.
Dr. Dodington, where is the silver lining as we go forward? Where do you see it?
I think the silver lining from me, and the folks that work with me closely in our work call me a relentless optimist. And you
You
have
gotta
to
be. You gotta be.
absolutely. Is that we are starting to see a national conversation, and you hear this from our Senator Chris Murphy. You hear this from our Surgeon General, and the Reverend so eloquently put this as the door was opened. That we think, and I tell this to my mentees, emergency doctors who are going to be always, sadly, this weekend in New Haven on the front lines of gun violence in our communities, and those that are suffering, that we're seeing a national conversation about gun violence as a public health problem. And in that conversation, we see a way forward to really bring evidence-based, evidence-informed interventions to this space that will hopefully see those numbers come down and those families get the supports they need, and we will see some real movement. I am optimistic that we will see those things. However, clearly, if you read the news and listen to NPR, you have to be worried that we have a lot of work to do.
Reverend, where do you see the silver lining?
I don't see the silver lining. I want to believe that the humanity that God created will step up before it's too late. That we won't need, disaster to take place. That we would recognize what God said we were when he said we were good in the beginning. And he believed in us. He put his word in us. He put his spirit in us, that we would recognize that life is worth saving. Life is worth changing the discourse and changing the design and lifting our community up from this tragedy. We don't have to go this way. We have people who, we have too many guns. We have too many gun cultures. We're teaching our kids to play Fortnite and other games, and it's all right. And they think that there's a restart button on life. There's no restart button once you take someone's life. This young man that killed my son is spending most of his life in jail. He'll never, have that fullness of life, and so he get caught into this play that we allow to play out in America, and we have to change. Where the silver lining is that God will show us a greater America. America will be greater again. It won't be because of the Republican or Democratic Party. It's because humanity would be that party that would step up and make a difference. And that's what we need to call them to do. Let humanity stand up and make the day.
Gratitude to you, Reverend Sam Saylor, for being here with us today, and Dr. Jim Dodington from Yale. I'm Sujata Srinivasan. Today's show is produced by Tess Terrible. Our technical producer is Bradley O'Connor. Thank you for listening, and be well.